Hello everyone, my name is Veronica Robatsunang and I am a student of Bachelor in Nursing Science. So, today I will be presenting about therapeutic communication in nursing practice, enhancing patient care through effective communication. So, therapeutic communication is actually a vital tools that nurses will use every day to build a trust, to understand the patient needs, and also to provide compassionate care. So, let's explore how these communication techniques actually can improve both emotional and also physical outcomes for our patients. So, introduction. Therapeutic communication builds relationship and trust between the nurses and patient. The purpose for this one is to promote physical and also emotional well-being. Therapeutic communication is about using communication intentionally to support the patient's well-being. It also helps the nurses to form a strong and a trusting relationships with patients. This relationship actually will become the foundations to deliver not just the medical care but also emotional support too. The ultimate goal is actually to promote the patient's physical healing as well as their emotional comfort. What is therapeutic communication? Therapeutic communication can be defined as the purposeful use of communication to support the physical, emotional, and also mental health of the patient. It is not random or casual. It is actually a planned and also thoughtful. And by this approach, it will build a rapport, support emotional needs, and also creates a safe environment where the patient feels heard, respected, and also understood. So, there are four core communication skills that will actually will make the therapeutic communication more effective. First, active listening. Active listening shows patients that we are fully present. Second is empathy. Empathy helps us to connect emotionally. And the third one is nonverbal cues, like eye contact and also posture, support what we say. And the last one is the clarification and also reflection. Clarification and reflection, making sure that we are truly understand what the patient means and also ensure nothing gets misunderstood. So let us go through for the first one is active listening. So everyone, active listening is actually at the heart of therapeutic communication. When the nurses, us, is truly listen to our patient without interrupting and also judging, it actually helps to build a trust. By simple action like this, like maintaining eye contact, nodding, and responding with an interest, um, it can make the patient feels more safe and also valued. And this openness, encourage them to share more, which will help us to provide a better care. Type. Next one is empathy. What does it mean by empathy? Empathy means understanding and sharing another person's emotions. In nursing, this allows us to connect with what our patients feel. whether they feel sad, fear, hopelessness, and as a nurse, by showing empathy, we actually validate their feelings and offer emotional support, which actually can improve their experience and also comfort during the care. Next, verbal and nonverbal communication. Our words actually matter, but so does how we say them. Verbal communication includes our tone, clarity, and the specific words we choose. Nonverbal communication cues like posture, facial expression, and gestures also communicate trust and understanding. So, when these verbal and also nonverbal messages align, patient will feel reassured and respected. Next will be the clarification and reflection. Clarification is actually when we ask question to ensure we understand what the patient means. For example, do you mean it actually can help to clear up confusion? So for the reflection is actually involving repeating or paraphrasing what the patient has said to shows that we are actually truly listening to them. And both of this technique actually will help to avoid miscommunication and strengthen the trust. So, the role of counseling in nursing communication. Counseling actually plays a key role in therapeutic communication. It allows the nurses to support the patients emotionally, especially when they are actually dealing with stress, anxiety, and also major life changes. So this type of communications build a therapeutic bond. It creates a safe space where our patient will feel more comfortable sharing their fears and asking questions. And also, it will help to guide patients in making informed decisions about their health. Next is encouraging expression and patient education. One of the goals of therapeutic communication is actually to encourage patients to express their themselves freely. So, when the nurses ask, listening without judgment, patients are actually more likely to express their feelings. They are more likely to share their feelings and concern. Education is actually a major part. Nurses need to explain the treatments and also condition in a simple, clear language so that our patient will understand the care and can participate in actively decision making. So, motivation and long-term support. In cases of chronic illnesses or lifestyle changes, counseling can help motivate patients. Motivational interviewing is a technique that inspires patients to make positive health choices. It will involve goal setting, helping patients define achievable health goals, and also supporting them every step of the way. And this will build a self confidence and improves long term health outcomes. So, to wrap up everything, therapeutic communication is essential in nursing. It allows us to build trust, support emotional health, and educate patients clearly and respectfully. By mastering all the skills like active listening, empathy, and counseling, we can actually make a difference in our patients' lives. Not just physically, but also emotionally as well. So that's all from me. Thank you for listening.